The male reproductive system. The perineum is the diamond-shaped area between the thighs. The anterior urogenital triangle contains the base of the penis and the scrotum. The posterior anal triangle contains the anal opening. The perineum. The scrotum. It's a two-chambered sac that contains the testes. The chambers are separated by an incomplete CT septum. Externally, you have the raphe, which is the seam. It's the irregular ridge that marks the midline of the scrotum. And then internally, you have the dartos and cremaster muscles. The scrotum, the cremaster muscle. This is an extension of the abdominal muscle, the internal abdominal obliques, into the scrotum. This is skeletal muscle, the cremaster muscle. The testes and temperature. When it's cold, the dartos and cremaster contract, so the size of the scrotum goes down and it pulls the testes closer. When it's warm, the dartos and cremaster relax and the testes descend away from the body. This is because sperm cells are very temp sensitive and problems with development happen if it's too hot or cold. The testes. They are small ovoid organs within the scrotum. They hang outside the body and they're 1 to 3 degrees below regular body temp. As an exocrine gland, the secretion is sperm and fluid that makes up 5% of semen. As an endocrine gland, it secretes the hormone testosterone. The testes, an endocrine gland. There are no ducts. They secrete hormones into interstitial fluid, which then enters the bloodstream. Endocrine gland. The descent of testes. The testes pass from the abdominal cavity to the scrotum through the inguinal canals, which are bilateral passageways in the anterior abdominal wall. The male babies delivered after 28 weeks, over 90 or more than 90% of them had normal testes descent. Descent of testes. Cryptorchidism. It's the failure of one or both testes to descend into the scrotum. It can cause sterility because of warmer temps. The disorder makes up 10% of testicular cancer cases. Cryptorchidism. Inguinal hernia. An abnormal opening in the abdominal region where the inguinal canals used to be open, through which a structure protrudes like part of the small intestine. The inguinal hernia. It's an abnormal opening through which a structure protrudes part of the small intestine. Epididymis. It's a duct. The tubule is about 23 feet long that is twisted and coiled, leaving the seminiferous tubules and attaching to the vas deferens. Sperm matures here. It takes 12 to 16 days for them to travel through this. They are fully mature when they leave, but cannot swim. It's the recycling center for damaged sperm. The epididymis. The vas deferens / ductus deferens. It's a tube that emerges from the tail of the epididymis and passes into the abdomen. The end of the duct enlarges to form the ampulla, which is a sac-like swelling. It's surrounded by smooth muscle that has peristaltic contractions to help propel sperm through. That is the ductus deferens / vas deferens. Peristalsis. It's a type of muscle contraction in a tube characterized by alternating waves of contraction and relaxation moving along the tube. Peristalsis. Spermatic cord consists of the vas deferens, testicular artery, and venous plexus, and the lymphatic vessels and nerves. Jesus Christ. Consists of vas deferens, testicular artery, and venous plexus, the lymphatic vessels, and nerves. It's covered by fascia and the cremaster. Spermatic cord. Testicular torsion. Twisting of the spermatic cord that causes decreased blood flow to the testes. Testicular torsion. Seminal vesicles. They are a pair of sac-shaped glands that secrete fluid which makes up 60% of the volume of semen. When seminal vesicle fluid mixes with the sperm, they begin I can't even read my own handwriting. They begin blank their flagella and swimming. They begin breaking, beating, beating. They begin beating their flagella and swim. The short duct joins the seminal vesicles. The short duct that joins the seminal vesicle with the ampulla is the ejaculatory duct. Seminal vesicles. Ejaculatory ducts. They're very short ducts. They're formed by joining of the ampulla of vas deferens and the ducts leaving the seminal vesicles. They extend into the prostate gland and open into the urethra, the prostatic urethra. Ejaculatory ducts. The prostate gland. It's a small, round gland that surrounds their urethra and ejaculatory ducts at the base of the bladder. Thin milky secretion. It's a thin milky secretion that makes up 30% of semen. It contains citric acid for sperm health, seminal plasma, plasma to combat UTI, prostate-specific antigen, PSA, to liquefy semen after ejaculation. Prostate gland. Digital rectal examination, DRE. It's a physical examination where a gloved finger goes into the rectum and touches the prostate through the rectal wall to check the size, the shape, etc. That is a digital rectal exam, DRE. Bulbourethral/Cowper's gland. This is a pair of small glands near the membranous part of the urethra, the size of a pea in young men, but decrease in size with age. It secretes mucus that makes up 5% of semen. The mucus neutralizes acidity of male's urethra and lubricates it just before ejaculation. That's the Cowper's gland. The urethra as a duct. It's a tube that extends from the urinary bladder to the distal end of the penis. The passageway for both urine and semen. Urine and semen never mix. While semen goes through the urethra, the sphincter that allows urine to empty from the bladder contracts, which keeps urine out of the semen and vice versa. Semen out of the bladder. The three parts of the male urethra. The prostatic urethra, which connects to the bladder and runs through the prostate gland. Then the membranous urethra, which is from the prostate gland through the perineum. It lies in this little tiny space you can see. It's just like this muscle. It's very thin. It's a very tiny part. And then after that is the spongy urethra, which runs from the membranous urethra through the penis. And that is the longest section. The external urethral orifice. This is the hole opening from the urethra to outside the body. The penis. This is the male organ through which sperm are put into the vagina. The organ for urination. There's 3 columns of erectile tissue that engorge with blood to enlarge the penis. The glans penis is the cap at the distal end of the penis, consisting of corpus spongiosum. The prepuce is a foreskin. It's a loose skin fold covering the glans penis. Semen consists of sperm cells and secretions from the male reproductive glands. The normal sperm count ranges from 75 to 400 million sperm per milliliter of semen. So 2 to 5 milliliters are ejaculated each time. Sperm can live up to 72 hours once inside the female.